Awareness for breast cancer screenings have been brought to the forefront after actress Olivia Munn announced her diagnosis. Munn credits the discovery of her cancer to the use of a risk assessment tool. I talked to a local expert about this test and how it can save lives. It's the diagnosis many are talking about. Actress Olivia Munn announced on social media she recently had a double mastectomy after her breast cancer diagnosis. Munn told her fans her yearly mammogram was normal, but she credits a risk assessment test for raising the alarm.
I anticipate that this will likely be a topic of interest in the very near future.
Dr. Lejla Hadzikadic-Gusic with Atrium Health says the risk assessment tests look at several factors.
On your family history, age, number of births, number of biopsies, atypical findings.
If your score is in the elevated range, doctors will likely monitor a patient and probably get an MRI, like with Munn.
Anything over 20% is considered high risk. And in that particular population, we strongly recommend increased surveillance.
The tests have been around since the late 80s, but have evolved with time. Dr. Hadzikadic-Gusic recommends staggering this type of test about 6 months after an annual mammogram, which doctors believe is still the best way to detect.
For example, you get your mammogram in December, you get an MRI in June. So twice a year, you're being followed versus waiting an entire year to get breast imaging done.
There are a variety of tests that might be right for some, but not others. Different factors play a role for the type of risk assessment test, depending on age and family history.